Thousands of women diagnosed with early breast cancer may not need to undergo chemotherapy. A study just published in the New England Journal of Medicine found that by using genetic testing on tumors, doctors could determine whether or not a patient required chemotherapy. That could mean as many as 70% of women who had early stages of one of the most common forms of breast cancer may not need chemo after all as part of their treatment. No chemotherapy means patients won't have to experience some side effects like nausea, hair loss, or a weakened immune system, or perhaps even worse, bone loss and osteoporosis. We have a doctor here to speak to us about it, Dr. Erika Hamilton. She's the director of the Breast Cancer and Gynecologic Cancer Research Program at the Sarah Cannon Research Institute. So glad you could join us from Chicago, Doctor. I can imagine this headline reaches us and we think this is big, especially if we have people in our family that have either undergone surgery or chemotherapy. But I'm sure it's even bigger news in your world. Tell us the impact of this.
Yeah, you're exactly right, Michaela. It's huge news. It's really groundbreaking. So this was a trial called Taylor-X, and it randomized 10,000 women volunteers who had hormonally driven early stage breast cancers. We used a test called the Oncotype TX, which is a test that we've been using for several years, actually, that classifies women into low risk where they don't need chemotherapy or high risk where they know they do. And what this study looked at is those that fell in the intermediate or the middle bucket, which is about 70% of patients. And it randomized them either to get chemotherapy or to get endocrine therapy, the hormone pill alone. And it showed that for the vast majority of these women, they didn't need the chemotherapy.
That's astounding when you think that that middle bucket was 70% of women. So let's talk about it. That does mean there are still a portion of women or people that have been diagnosed that are going to require chemotherapy.
That's correct. We know that the women that are in the high risk category do. And so most of the women in the intermediate we know now don't. There was a caveat. Those women that are particularly young, less than 50 years old, unless they were in the very low portion of that intermediate bucket, they still did need chemotherapy. So for the very young women, this still may not completely spare them from chemotherapy. But again, this means for early stage breast cancer, almost 70% of women probably don't need chemotherapy anymore. So this is probably about 60,000 women in the U.S. a year that now will be spared chemotherapy.
Yeah, and if you know anybody, you know that it takes a lot out of you. That kind of treatment really does, mentally, physically, emotionally. But let's ask one quick last final question, Dr. Hamilton. There are women right now that are in the midst of their treatment with oncologists. They're either on their way to an appointment, they're sitting in the waiting room waiting to go in, they're midstream. What happens in those cases?
Yeah, I think that's a conversation for that individual woman and her doctor. This is an initiative that's across oncology right now, personalized medicine, where we're really trying to tailor the individual results with individual treatment for patients and not using a cookie-cutter one-size-fits-all approach. So it's a win for the healthcare community, and it's certainly a win for patients, and I think very generous for these women that volunteered for this trial to help all women moving forward.
We're glad to hear that, because it certainly feels intensely personal when you're going through it, and it's nice to know you're going to have that care tailored to you. Dr. Erika Hamilton, thank you so much for joining me and sharing your expertise.
Thank you so much for having me.
Absolutely.